Hi, my name is Hannah Rudman, and I'm presenting my final project for Ethics in Human Service Counseling. My topic of discussion today is the impairment of counselors. What is the definition of the impairment of counselors? The American Medical Association defines an impaired counselor as the inability to deliver competent patient care resulting from alcoholism, chemical dependency, or mental illness, including burnout or the sense of emotional depletion which comes from stress. When looking at the types of impairment, there's burnout, temporary emotional imbalance, stress and anxiety, drug and alcohol abuse, exploitation of clients, over-involvement and overwork, and contagion. When looking at the signs and symptoms of impairment, for burnout, there's an unwillingness to discuss work in social and family circles, as well as a reluctancy to check for messages and return calls. For temporary emotional imbalance, there's an experience of a devastating personal loss or trauma and not taking time off to regain that emotional balance. For stress and anxiety, there can be inappropriate behaviors, as well as being late for appointments and canceling appointments with clients. For drug and alcohol abuse, there can be a loss of control, as well as problems with memory, attention, and physical health. For exploitation of clients, there can be a depressed and lonely mood or fragile self-esteem. There could also be a difficulty establishing intimacy in your personal life. For over-involvement and overwork, you could see the professional sacrificing their own needs and concerns for the benefit for others. You could also see the professional being deeply enmeshed with clients. And lastly, for contagion, you can see the professional focusing all of their energy on understanding the inner experience of the disturbed client. Why is the impairment of a counselor an ethical issue? This topic raises concerns for an ethical violation, as the impairment of a counselor can lead to potential harm for the client's welfare. It can lead to loss of empathy, respect, and positive feelings towards the client. It can lead to poor judgment. It can lead to defensive or hostile behavior, the professional being unresponsive to the patient's needs, or it can lead to sexual relationships. For my case study, we're looking at Janice. Janice is a 6-year-old woman who has been working within the addiction field for over 20 years. She also has been sober for 35 years. You and Janice have been working at the same treatment center for 2 years now and have become close colleagues. Janice is undergoing a divorce, which has been heart-wrenching for her. You have noticed lately that Janice has been coming in late to work, not meeting the dress code, and visibly upset each day. One day, Janice comes into work 2 hours late and is stumbling down the hall. You smell alcohol on her breath. You ask her a few questions, but she seems very forgetful and confused. What should be done in regards to Janice and her behavior? Well, when looking at the ethical standards of the NAADAC Code of Ethics and breaking it down into these 6 categories, for autonomy, as Janice's coworker, I would allow her the freedom to make her own decisions, consequences from her actions instead of reporting or addressing the behavior myself. For non-maleficence, based on Janice's recent presentation within the workplace, she has the potential to place herself and her clients at the risk of harm. For maleficence, to help Janice and the clients she is serving, it would be beneficial to intervene after observing the concern and potential harm in Janice's actions. For justice, in order for Janice to provide fair and equal treatment to her clients, she needs to be emotionally and physically stable. Based on her recent orientation, she is not. For fidelity, even though I am Janice's coworker and friend, I have a duty as a clinician to be true to my word as a professional, obeying all ethical practices and reporting any ethical violations. And last, for veracity, I have recently witnessed Janice's behavior, and it is my job to report my truth and accuracy of the situation. So looking at the applicable codes from the Maryland law, and looking at the Code of Maryland Regulations, COMAR. I specifically targeted Title 10, the Maryland Department of Health, and looked under Section 1042.0304, Part C, the responsibility of colleagues. And this just really dives into, if colleagues do have the knowledge of the impairment or incompetence of their colleague, it is their responsibility to report that impairment or incompetence to the board. Also looking at Section 1042.0306, Part B, 1A, specifically the standards of practice, it says, undertake or continue a professional relationship with a client when the competence or objectivity of the licensee is or could reasonably be expected to be impaired due to mental, emotional, physiological, pharmaceutical, substance abuse, or personal problems. So my recommendations for this case is based on the ethical standards and codes from the Maryland law reviewed in the case. It would be my duty as a professional to report any type of impairment observed. Although Janice is a close colleague at work and is going through a difficult time personally, it would not benefit her or her clients to continue engaging in this type of behavior in the workplace. After witnessing Janice's signs and symptoms of impairment, I would intervene and address her first to provide her the opportunity to seek the help that she needs on her own. However, if she does not, I would report my concerns to my supervisor in hopes that Janice receives time off to emotionally process her divorce and regain control over her sobriety. When reflecting back on this case, I really look at the professional experience that I have had in the addiction field so far. And I strive to build strong and trustworthy relationships with my colleagues in the field. When reflecting back, I believe it would be personally challenging to report my colleague's impairment because I would be afraid of the repercussions my colleague would receive and the guilt I would face if I were to report them personally. I would feel more comfortable addressing them personally and providing them an opportunity to receive the help they need. However, if they choose not to do that and continue the harmful behavior, I would choose to report my concerns to my supervisor and let them address the issue accordingly. When looking at my own values and how they influence this case, I want to always be an honest friend and an honest colleague, but also be ethical and honest as a professional. As much as I would want to support my colleague and be there for her, I have an ethical duty as a professional to report her behavior. And these are my references. Thank you.